self-belief. So it has been a long time since I recorded anything about medical life. Today I'll talk about maneuvers and murmurs. Why murmurs? Because murmurs are a topic that if you didn't understand them, so you will hate them. But if you understand them, you love them. So there's no in between. Murmurs, either you love them or you hate them. So I will talk about maneuvers that affect the murmurs. Firstly, we have maybe 6 or 7 or 5 maneuvers. The first one I'll talk about is respiration. So let's get started. Okay, so when we talk about respiration, we have 2 cycles, inspiration and expiration. So during inspiration, we have this rule. During inspirations, the right-sided heart murmurs increase. That's using the blue one. Okay, the right-sided heart murmurs will increase, and the left-sided heart murmurs will decrease. What are the right-sided heart murmurs? They are tricuspid murmurs and pulmonary murmurs. Okay. Either it is stenosis or regurgitations. So the right-sided heart murmurs will increase while the left-sided heart murmurs will decrease during inspiration, and I will explain this in a few seconds. So what are the left-sided heart murmurs? They are the mitral valve murmurs and the aortic valve murmurs. Okay. So you'll ask me, what is the explanation for that? Okay, we have 2 things. During inspiration, so here is the thoracic cavity and here's the abdominal cavity. During inspiration, the pressure inside the thoracic cavity will decrease. So decreasing the pressure inside the thoracic cavity, meaning that the blood that return from the superior vena cava to the heart will increase. Okay, increase the returning blood from the to the heart, meaning that increasing the turbulent blood flow through the murmurs here in the right side. So meaning that it will be increasing in intensity, will be louder. So okay, this is understanding. But what about the left-sided murmurs? Why they decrease during inspiration? Okay, but during inspiration too, we have increasing in the heart rate a little bit. So increasing in the heart rate, meaning that in the left side from the aorta, the blood will be pumping a lot. So there's not a lot of blood. So there's less blood amounts in the left side, meaning that the turbulent blood flow will be decreased. So the left side heart murmurs will be decreased. So this is the explanation for inspiration that increase the right-sided heart murmurs and decrease the left-sided heart murmurs. And what about expiration? Expiration is the opposite for that. Expiration decreases the heart rate. Decreases the heart rate, meaning that in the left side will be more turbulent blood flow. That means increasing in the left-sided heart murmurs. And during the expiration also, the pressure inside the thoracic cavity will be increased. So blood returning from the superior vena cava to the heart will be decreased, meaning that the blood amount and flow and the turbulent flow in the right side will be decreased. Okay. So this is about the first thing, which is the respiration. So here is a question. If you're examining a patient and you hear a diastolic murmur in the left sternal side, and during inspirations you notice that this murmur increase, what this murmur will be? What will be your answer? Is that aortic regurg or this is pulmonary regurgitation? Of course, it's what? It is pulmonary regurgitation. Because pulmonary regurgitation, it is what? It is a right-sided heart murmur, and it increases with inspiration that we hear it in the second intercostal space, while the aortic regurgitation is the left-side heart murmur that we hear it in the third left sternal space. Okay, let's talk about the position. In the position, we have 2 positions. We have standing and squatting positions. So squatting and standing positions. So here is the rule here. Most murmurs, and when I say most murmurs, meaning that not all of them, because we have murmurs that are the opposite of both of them. So most murmurs on standing will decrease, and on squatting will increase. Okay, increasing the murmurs, whilst standing decreases the murmurs. Why? Okay, during squatting we have to know that this is a squatting position, and we have the abdominal cavity. During squatting, the abdominal cavity pressure will increase, meaning that we have 2 things will happen. What? Okay, so the pressure inside the abdomen increase, meaning that the blood will go from the high pressure areas to the low pressure area, which is the heart. So increasing the blood returning to the heart. And the second thing will happen that the blood outflow and cardiac output will decrease because of the increasing pressure in the abdomen. So the blood inside the heart will increase, meaning that the turbulent blood flow will increase, meaning that the murmurs will be louder, will be more intense, and yes. And this is the opposite for what happening during standing. During standing, the abdominal pressure will decrease, meaning that the blood flow to the heart will be decreased, and this means that turbulent blood flow inside the heart will be decreased, meaning that the murmurs will be softer and will be less intense. Okay, and this is for most of murmurs. But we have what? We have 2 murmurs, which are the hypertrophic cardiomyopathy and mitral valve prolapse. So what about them? Okay, so let's talk about story of hypertrophic cardiomyopathy. No, this is small heart. This is the heart and this is the interventricular septum, which increasing in size in hypertrophic cardiomyopathy. And here is the aortic valve, and here is the mitral valve. And the unique thing about hypertrophic cardiomyopathy that the murmur happens not because of the turbulent blood flow. No. Okay, it happens not because of the turbulent blood flow, but in the hypertrophic cardiomyopathy, the murmurs happen because of the valve here and the valve here. Will what? Because this is enlarged in size, so the valve will hit the interventricular septum during filling and systolic and diastolic. So what if we have a lot of blood that comes to the heart? A lot of blood that comes to the heart, meaning that there is a space here. So there's a space here because of blood filling this space. So there is no murmur. There will be absence of the murmur, or there will be less intense and softer murmur because of the blood prevent the meeting of the valve with the interventricular septum. While if we have a less blood, meaning that yes, they will meet. So they will making hand five. So if we have decrease in the blood amount that coming to the heart, meaning that the valve with the interventricular septum will meet, so this will make a sound, which is the murmur of the hypertrophic cardiomyopathy. While if there is a lot of blood in the heart, meaning that there is a space and there is there is something that prevents the meeting of them, so there is no murmur. Okay. So this is the opposite for hypertrophic cardiomyopathy. So during squatting meaning that increases blood in the heart, while standing meaning that decreases blood in the heart. Okay. So during squatting increases blood in the heart, meaning that there is decrease in the murmur of hypertrophic cardiomyopathy, while during standing will be increased. While in the mitral valve prolapse, it is a mid to late diastolic murmur. Okay, it is diastolic murmur on the left side, and this is mid to It is mid to late diastolic murmur. So during squatting, increasing the blood in the heart, meaning that there is a lot of time for the ventricles to fill the blood and then to contract. So this will be slower and there is maybe no murmur for mitral valve prolapse. While during standing, meaning that the blood is lesser in the heart, less amount of blood in the heart, meaning that the ventricles will be pumping faster and quicker, meaning that the murmur will be louder, more intense, and will be more quicker. Okay. So mitral valve prolapse and hypertrophic cardiomyopathy, they are odd. Okay. So this is for respirations, inspirations, expirations, and positions, standing and squatting. The fourth maneuver here is the hand grip maneuver. Hand grip meaning squeezing of the hand. Squeezing of the hand meaning that the arterioles, the peripheral arterioles here, will be against this part, meaning that the afterload will be increased after load. Okay, increasing afterload meaning that increasing afterload, and this is the heart. Let's draw it. Increasing afterload meaning that meaning that there is a pressure here and there is a pressure here, so the hand grip will decrease the pressure gradient between the aorta and between the left ventricle, so decreasing the pressure gradient. Okay, decreasing the pressure gradient, what does that mean? So what if we have aortic stenosis here, okay, and there is a lot of blood, here is a pressure, a high pressure, and here is a pressure also too, and the blood will wants to passes from the aorta, which is have a stenosis, aortic stenosis here, and there is a less pressure gradient, meaning that the aortic stenosis will be lesser. So aortic stenosis for hand grip will be decrease in intense. While what if we have aortic regurgitation? Aortic regurgitation is during what happens? The murmur happens during the diastole. Okay, during the diastole. So during diastole, and this is filling the blood from here, and here is a high afterload. That meaning that there is a lot of blood will come from the aorta to the left ventricle too. So blood from here and a lot of blood from here, meaning that the aortic regurgitation murmur will be increased or decreased. Of course, it will increase. So increasing aortic regurgitation in hand grip. Okay, it's all about, you have to remember that it increases the heart, the afterload. Okay, increases the afterload, decreases the pressure gradient. Okay, what about mitral regurg? So here's a mitral regurg, and it's during what? It's during systolic. Okay, during systole, so here is high pressure that reflects the contractions of left ventricle here. So the blood will pumping more stronger. So this will cause a high mitral regurgitation murmur. So yes, for mitral regurg and for aortic regurgitations will be increased with hand grip, but aortic stenosis will be decreased with the hand grip. Also for hypertrophic cardiomyopathy, also will be decreased in hand grip. Okay, and you can know that by yourself because you already know what's the story about the hypertrophic cardiomyopathy. Okay, the last condition here, it is the ventricular septal defect. Let's draw the heart. and this is normal heart. What if we have ventricular septal defect here? And what we are talking about here is the size of ventricular septal defect and its effect on the murmur sound. So what if it was a small ventricular septal defect? Small ventricular septal meaning that there is less space and less space for blood to flow from. So this will increase the intensity and will make the murmurs louder. Okay, so if ventricular septal defect, as it is smaller, it will increase the murmurs intensity. What if it was large? So here is a large space for the blood that can cross the ventricular septal defect. Okay, so this will mean that less turbulent blood flow and less blood amount, less murmur intensity. So increasing the size of SD, meaning that decreasing the intensity of the murmur. And that's the end of the maneuvers and their effects on murmurs. Okay, so we have respiration, inspiration, and expirations, and we have opposition, standing, and squatting. We have odd things, which are the hypertrophic cardiomyopathy and mitral valve prolapse. And mitral valve prolapse, we see it with Marfan patients. Okay, and Valsalva maneuver, which has the same effect of standing. And we have the handy grip, okay, which are it's about increasing the afterload and decreasing the gradient in the pressure. And we have ventricular septal defects, which if it's large, so it will decrease the murmur intensity. And that's it. Thank you.